Let's walk through some possible nursing diagnoses for a patient with asthma. So, nursing diagnoses are used for your care plans, and it has three parts to it. You've got the actual NANDA nursing diagnosis, you've got the related to factor, and you've got the as evidenced by. So, the nursing diagnosis is what is actually going on with the patient's body, what's their response to the disorder. So, for asthma, this could be things like impaired gas exchange, ineffective airway clearance, or ineffective breathing pattern. And then we move down to the related to. This is the second part of your nursing diagnosis. This is the pathophysiology. And I want you to be thinking about the patho as you do the related to, because that's really gonna help deepen your critical thinking skills and also impress your instructors. So if you can show your nursing instructors that you know what you're talking about because you know the pathophysiology behind what is going on with your patient, that's gonna go a long way. So for here with asthma, we've got inflammation in the airway, bronchial secretions, and obstruction of that airway. Those are all possibilities for the pathophysiology of what's going on. And then we have the as evidenced by section. This is your signs and symptoms that you actually see and assess for in your patient. So this could be things like cough, decreased oxygen saturation, increased work of breathing, increased respiratory rate, adventitious breath sounds, or abnormal ABG results. So what we want to do is think back to the patho when you're writing that related to section, when you're writing your nursing care plan, because the pathophysiology is the foundation for everything else that you need to know for a disorder. And when you're at clinical, I really recommend that you take really good notes and start your care plans early, because you don't want to forget all of this, like the signs and symptoms and things, by the time you get home. We want to make sure that you're writing your care plans properly and not forgetting anything when you leave clinical, because that's a very easy thing to do. So make sure that you take really good notes for the signs and symptoms, and even put in some possible nursing diagnoses or related to factors. Be thinking about those through your clinical day so you can write your care plans when you get home.